Hi, everyone. Good afternoon. We meet again in the Federation of Asian Veterinary Association and World Organization of Animal Health, or OIE, and Pet Fair Southeast Asia. Hope all of you are fine and safe. Even the situation of COVID-19 is becoming more relaxed. I'm very happy to see you and meet you again in FAVA and WOAH and Pet Fair webinar in 2022. In the regional webinar on Rabies Day 2022. Today's webinar theme is Rabies, One Health, Zero Death. So this theme is very strong to us on focusing the rabies disease. With a sub-theme of rabies control strategies in Asian episode 3rd. We already have before episode 1st and episode 2nd, now becoming the episode 3rd. In today's webinar, we will listen from the expert from WOAH and 3 Asian countries on how their control strategies in combating the rabies disease. Today's detailed agenda is opening message from FAVA President Dr. Quazza Nizamuddin, introduction speakers presentation every 20 minutes, discussion and closings. If you have any question during the presentation, you can write in the chat box. Before we start the webinar, I would like to invite Dr. Quazza Nizamuddin, the FAVA President, to give the opening welcome and message. Dr. Quazza, the time is yours. Please.
Thank you, Professor Dr. Bambang Ponjo Priyosaryamto, for the kind introduction, and Professor Dr. Acharya Salasut for coordinating this webinar. Greetings to all veterinarians, farmers, and industry players in the livestock sector. It's indeed an honor and privilege to speak at this regional webinar in conjunction with World Rabies Day 2022 with the theme Rabies One Health Zero Deaths. I take this opportunity to welcome Dr. Ronelo Abila from the World Organization of Animal Health and Dr. Isao Kurauchi, President-elect of Federation of Asian Veterinary Associations, who are with us today. I congratulate the World Organization for Animal Health, FAVA, Pet Fair, Southeast Asia, and VNU Asia Pacific Exhibition Services for working together to organize this webinar. Ladies and gentlemen, today we have three speakers. One is from Nepal, Thailand, and also Vietnam, who will share their approaches in controlling rabies. I'm sure their experiences and knowledge will be useful for members to enhance their ability to improve rabies control in their own countries. Ladies and gentlemen, as you may know, FAWA, or the Federation of Asian Veterinary Associations, is a 27-member association comprising of 24 member countries in the Asia-Oceania region with 2 associate and 1 affiliate members. The outreach is more than 100,000 veterinarians. FAWA plays an important role in working with national veterinary associations to carry out projects and activities to benefit member associations. Ladies and gentlemen, World Rabies Day is conducted every year on the 26th of September, with many countries, regions, and organizations having awareness campaign program on this day. It's an important reminder to all of us on the mission ahead. Rabies infection, as you may know, causes around 59,000 human deaths worldwide, with one death every 9 minutes, and nearly 60% were recorded in Asia. 99% of human cases resulted from dog bites. The annual economic losses is estimated to be about US dollar 8.6 billion. Ladies and gentlemen, the burden of rabies is disproportionately borne by underprivileged communities, exacerbated by the poor awareness and inequitable health care. Ladies and gentlemen, in humans, the strategies revolve around bite prevention, basically avoiding bites. But if bitten, rabies post-exposure prophylaxis is crucial, as washing with soap and running water at bite site and seek immediate medical attention for immunoglobulin and vaccination based on risk assessment. In animals, vaccinating 70% of dogs in high-risk areas breaks rabies transmission cycle, and dog population management will have. Ladies and gentlemen, a global call for action resulted in FAO, WOAH, WHO, and GARC joining forces to develop the country-centric zero rabies by 2030. The global strategic plan to end human deaths from dog-mediated rabies will be undertaken by 2030. The broad objectives were to effectively use vaccines, medicines, tools, and technologies to generate, innovate, and measure impact, as well as to sustain commitment and resources. To enhance these efforts, FAO, WOAH, and WHO launched the United Against Rabies Forum in 2020, which aims to accelerate progress on rabies elimination while applying a One Health approach. The forum promotes cross-sector collaboration among stakeholders and support countries in their rabies elimination efforts. Increase political engagement and resource mobilization, both internationally and nationally, will be needed to achieve global rabies goals and can also make One Health implementation a reality. However, the COVID-19 pandemic has also set back many countries' efforts towards rabies elimination, but renewed efforts are underway. Ladies and gentlemen, it requires a whole of society engagement with all sectors and disciplines working together towards the elimination of the various plans laid out. The commitment by stakeholders have been good. We need to build and keep the momentum going and participate actively to help in the mission as rabies is 100% preventable. FAVA is in a unique position to actively play a complementary role in providing communication and advocacy through our networks to enhance and strengthen the efforts undertaken. We hope our goals will be achieved to end human deaths from dog-mediated rabies by 2030. Ladies and gentlemen, lastly, I would like to thank Dr. Ronelo Abila, Dr. Kongsak Tang Tum, Dr. Sujan Rana, and Dr. Pan Kwang Min for speaking in today's program. I wish you all a successful webinar, and together we will strive to make a difference. Stay safe and stay healthy. Thank you.
Thank you, Dr. Kwasa, for the opening message that very meaningful for us, what Dr. Kwasa mentioned. Now, I would like to invite Dr. Ronelo Abila, sub-regional representative for Southeast Asia of the World Organization for Animal Health, for given opening message in today's seminar. Dr. Ronela, the time is yours.
Thank you, Professor Bambang, and also thank you to the President of FAVA, Dr. Kwasan Nisamuddin, the Vice President, Dr. Isao Kurouchi, and our three experts from the countries in Thailand, Dr. Konsak, Vietnam, Dr. Long, and from Nepal, Dr. Sujan. To all the participants in this virtual webinar, a pleasant good afternoon to all of you. I would like to reiterate our collaboration with FAVA in enhancing communications campaign and the control of rabies in the region. I am really very thankful for so many years we have been partnering with FAVA in the conduct of these webinars during World Rabies Day celebration. It's quite important that we continue to reiterate the importance of rabies control. As the theme for this global celebration is indicated, One Health, Zero Death. It's quite important how we could really make this theme for this year be distributed widely, not only among the veterinary professionals and other One Health professionals, the medical doctors and other allied medical professionals, but mainly to the politicians, policymakers, and also to the community. As we all know, rabies is one of the oldest disease, and with all the developments of new technologies, very effective vaccines, which is very affordable, vaccines for dogs. Actually, it is I would say now it's quite easier to control rabies if we really focus on controlling rabies in dogs. But until now, we are still facing the constraints on how to make this effective. And we are still encountering issues on how we gain support for the control of rabies in dogs. And one of the issues here is that the concept of One Health really getting this responsibility as a whole of government and whole of society responsibility to control rabies is not yet there. And one of the biggest challenges here is, if we really look at the start, is how the government prioritizes in putting resources to control rabies in dogs. It's been an issue for many countries and for quite some time that allocation of resources, investment to purchase vaccines and to implement vaccination in dogs is encountering a lot of challenges. Many Ministry of Agriculture say that it is not their mandate, and their mandate is the control of transboundary animal diseases, because dogs is not livestock, and rabies really is not a disease of livestock for production. So many Ministry of Agriculture don't really allocate resources for that. Although the veterinary services, veterinary professionals has been advocating for this, it has still is still really gaining very minimally. So it means that we still need to exert more efforts to convince governments, particularly Ministry of Agriculture, to put resources to buy vaccines. And at the same time, the Ministry of Health, they would say that they cannot buy vaccines for dogs because they could only buy vaccines for humans. So the principle of One Health, one government, a whole of government approach to rabies control is still not really fully existing. So we have to continuously advocate for this, convince our government, convince Ministry of Agriculture, Ministry of Health to work together, and convince our politician, Ministry of Budget and Finance to really provide resources. And of course, we can do that if it is the whole community, the whole population who will really advocate to provide resources to control rabies. And if that happens, that we could really mobilize resources, that all this verbal commitment is really transformed into reality with resources provided to control rabies, then we will see that day that we could really be working together and we could effectively control rabies through One Health approach. So we hope that all participants, I presume many of you are veterinary professionals, you could advocate to your respective government to really put resources in controlling rabies. Thanks a lot.
Thank you. Thank you, Dr. Abila, for the opening message from World Organization for Animal Health. That's only a piece of what Dr. Abila will talk today. And we hope that Dr. Abila will talk a lot and more deeply about the rabies. Okay, so we will start with the presentation of our today keynote lecture. First, I would like to introduce two speakers today, especially for the first speakers. The first speaker is Dr. Ronelo C. Abila. Dr. Abila is a Filipino veterinarian. Is the sub-regional representative for Southeast Asia of the World Organization for Animal Health, or before we know as OIE. He graduated as a doctor of veterinary medicine from the University of the Philippines in Philippines, and Master of Science in Epidemiology and Preventive Veterinary Medicines from the Free University of Berlin in Germany. Dr. Abila joined the WOAH in June 2004 as a regional coordinator of CA-FMD campaign and continue in September 2007. He was given additional tasks for manage the OIA House Aid program on strengthening veterinary service in Southeast Asia. He worked with the eradication of FMD in the Philippines and in various OIE support to control FMD in Myanmar and Laos PDR. He also coordinates the sub-regional control of rabies in Southeast Asia, supported by One Health component of the STANS program. He supervised the development of Southeast Asia dog rabies elimination strategy, which was later transformed into the ASEAN Rabies Elimination Strategy, or ARES. His keynote lecture today is about update on World Organization for Animal Health Rabies Control Strategies. Please welcome Dr. Abila. Dr. Abila, the time is yours, please.
Thank you again, Dr. Bambang. Okay, I'll share my screen. Just a moment. Okay. So for my next couple of minutes, I'll be presenting updates on the World Organization for Animal Health support at the global and also at the sub-regional, sub-regional level, particularly here in Southeast Asia. So this is the outline of my presentation. Okay, just to have some, I would say, a few review of some facts to really advocate. As I mentioned in my opening speech, we really need to advocate to our policymakers to support rabies control. 99% of human cases due to rabies bites are coming from infected dogs. Okay, and of this, more than 95% of the world's fatal rabies occur mainly in Africa and in our continent in Asia. And more than 80% of rabies cases occur in rural areas where there's a lot of roaming dogs, stray dogs, and with very limited access to health education campaign and post-bite treatment. And 4 out of 10 rabies deaths are mainly in children. Okay, so we mentioned that in our theme for today is really One Health, 0 deaths to rabies. And rabies is really a good model for One Health implementation. Okay, so why we are saying this? It has been proven that with the application of One Health approach, we could control rabies. The cost of dog vaccination is the most effective way to save human lives, and it's more than 100% cheaper to vaccinate dogs than to use post-exposure prophylaxis in humans. The reduced livestock and working animal losses. So we will reduce rabies cases, particularly in working animals. It will save livelihoods and improve food security. Responsible dog ownership and human dog population management would lead to a healthier cities, improve animal welfare, and also with proper management of healthier ecosystems will also reduce spillovers of rabies coming from wildlife, and we could strengthen links between human and veterinary health systems in the control of rabies. So it's really quite a very good example, a model for implementing One Health approach. Okay, to control rabies, we have these key principles, 4 key principles on how we could effectively eliminate dog-mediated rabies, which include surveillance and monitoring, So if we could really detect early rabies cases and focus our limited resources in those areas, then we could eliminate rabies. And we could eliminate rabies in those areas that has been detected having circulation through mass dog vaccination campaign. If we will vaccinate 70% of the population, you know already this, we could really cut off the transmission of rabies. And coupled with this is the effective control of the stray dog population, reaching a rabies immune or rabies-free dog population while ensuring that animal welfare is respected. And cutting across in all of this is an effective public awareness and education campaign. So if we have these 4 components in our program, with the World Organization for Animal Health has come up with a program to recognize for an endorsement of an official control program. So with this resolution number 19, national government member countries can submit to the World Organization for OIE for an official endorsement of your rabies control program. And they're among the very first countries whose rabies national program was been recognized by WOAH is from the Philippines. Way back in 2021, the very first program, among the 2 first programs recognized globally. One is Namibia and one in the Philippines for Asia and the Pacific. So we encourage other countries to with this program, with this rabies control program that's being implemented effectively, to submit your official control program for recognition to OIE. And with that, you will have more advantage to advocate for more resources from the government and also from the donors to support your rabies control program. Okay, so these are some of the, I would say, some of the advantages if you would apply for endorsement of official control program. So this program will be have a strong partnership with the support of national and public health authorities, and also will be if you receive this endorsement, you could really, as I mentioned earlier, it will provide a strong evidence to advocate for increased support and investment from your government and also from other donors to support rabies control in your country. The United Against Rabies, which I will also mention later on, has come up with this template to support national in the development of national strategic plan. So the WOAH is now working with some of the member countries. We will start with Cambodia. So we have hired already a consultant with Cambodia to update their national rabies plan using this guideline coming from the United Against Rabies, coupled also with the standards and guideline provided by the Terrestrial Animal Health Code of the OIE. The other support that we are implementing, as I've mentioned, we have these international standards which provide a science-based standard and guidelines and recommendation to prevent and control rabies in animals. And another program that we have is the Rabies Vaccine Bank, and we have already delivered more than 20 million doses since it started more than 10 years ago to more than quite a significant number of countries from Asia and the Pacific. We have provided in more than 12 countries with the delivery vaccine bank. The most recent one, it has arrived last Monday. 200,000 doses of rabies vaccines we have delivered to Indonesia. So for the pilot revive again the vaccination, the rabies elimination program in Bali province in Indonesia. So this 200,000 vaccine is the first part of the delivery that we will be working with the government of Indonesia and with other partners in controlling rabies in Bali. So we also provide some in-country evaluation missions. We have now the program, what we call the National Specific PBS Evaluation for Rabies. And we have also some program of National Bridging Workshop, which in some cases we could also focus this on rabies. In terms of international collaboration, we have been working with other partners, and most recently, we have launched the United Against Rabies Forum, and together with the different partners, the WOAH together with other partners have developed the 0 by 30 strategy. So some of the forthcoming activities under the United Against Rabies, comprising of FAO, World Organization for Animal Health, and World Health Organization, WHO, and other partners, other NGOs. It was established in September 2020, and some of the activities that we will be working is really to enhance in developing programs and support for the countries to reach this target of having a 0 human deaths from dogs by year 2030. Some priority activities under the United Against Rabies is for 2022 is the engagement of local authorities, maintenance of rabies in One Health political agenda, facilitate knowledge transfer, engage, empower and facilitate the work of national stakeholders, and expand and engage membership and engage wider health development and community. And as I mentioned in the very first bullet, is really the critical role of local authorities. For the WOAH sub-regional representation for Southeast Asia, we are now partnering with the Asia Pacific City Alliance for Health and Development. It's called APCAT. So they have a strong alliance of local authorities, cities, and municipalities and towns in Asia and the Pacific, and of course, including also provincial governments, working on health and development. And we are now working with them to collaborate in the control of rabies at the local level. And the control of rabies, the pilot control of rabies in Bali is one of the area where we will be working together with the government of national government of Indonesia and the local government of Bali, together with EPCAT. So in October, 4th of October, a global webinar will be conducted by the United Against Rabies, tackling rabies and dog rabies management, the role of local authorities. We would really like to highlight, the role of local authorities in the control of rabies. I know in many countries, for example, in the Philippines, the role of the Philippine cities and municipalities leagues of veterinary offices has been very critical in the implementation and effective implementation of rabies control in the Philippines. Okay, in the region, some of the focus activities we have is the review of ARIS, the Asian Rabies Elimination Strategy. It was launched in 2014, and the initial target is until 2030. So it's been now really 2 years behind that it needs revision. So we have hired a consultant. We have worked with the ASEAN Sectoral Working Group for Livestock and the ASEAN Health Cluster 2. So next week, representative from the ASEAN Health Cluster 2 and from the ASEAN Sectoral Working Group will meet with the consultant together with WOAH to start the discussion, the processes in the review of the ARIS. Now we have also have a pilot support for Cambodia, as I mentioned earlier, to update their national plan. As I mentioned also, we are now partnering with the Asia Pacific APCAT, the Asia Pacific City Alliance for Health and Development. We are also conducting various trainings and workshops to support rabies, and we continuously disseminate various information and guidelines through our website. So this is now the process for the review of ARIS. Since last year, actually, we've been doing a lot of consultation with the ASEAN Secretariat and the development of the TOR, and also now that consultant has been hired. So the next step now is to come up with the actual revision of the ARIS in consultation with the representative from the health sector and animal health sector from ASEAN. So for this World Rabies Day celebration, we have disseminated communication to all member countries who would need some support. This was initiated by our office in Tokyo. So for those countries who would need more support of their activities for the World Rabies Day until next week, you may indicate this to our colleagues, to us or to our Tokyo office. We are gathering success stories and best practices of rabies control, and this will be featured in our website. And then through the tripartite and also now quadripartite, we are also gathering best practices in controlling rabies through One Health approach during the time of the pandemic. Okay, and as I mentioned earlier, the 200,000 doses of vaccine has already arrived in Indonesia, and very soon it will be launched in Bali. We have these resources, and you can visit our website, the different resources that is available to support rabies control in the region. I think that's the last part of my slide. Thank you very much.
Thank you, Dr. Abila, for the nice presentation. And now we know what the WOAH activity in some Asian countries, especially for the rabies, controlling the disease of rabies. Now, I would like to invite Dr. Kongsak Tiangtum for the next presentation. First, I would like to introduce Dr. Tiangtum. Dr. Tiangtum was graduated PhD from Kasetsart University, Thailand in 2012, studied biotechnology and agricultural products. He is a dean at the Faculty of Veterinary Medicine, Kasetsart University. His expertise involves various clouds such as animal reproduction, feline medicines, animal welfare, which are expertise that he is interested. His recent research involved National Animal Cell Bank development for biodiversity conservation and sustainable utilization. Dr. Tiangtum will share with us about the saving animals and humans from rabies projects under the determination of Her Royal Highness Princess Chulaborn Mahidol. Please welcome Dr. Tiangtum. Dr. Tiangtum, the time is yours. Please.
สวัสดีครับ Good afternoon, everybody. First of all, I would like to thank organizer who give me a chance to talk with you about project related to rabies elimination in Thailand. And I do apologize that cannot attend the meetings myself today due to my urgent special activities. The topic I am going to talk with you is saving animals and human life from rabies project, following the determinations of Her Royal Highness Princess Chulaborn Mahidol. Rabies is considered a dreadful zoonotic disease. From the WHO reports, there are still substantial number of human casualties resulted from this zoonotic disease annually. In Thailand, look back in past 20 years, the number of dead people and percentage of positive samples in animals were declining. However, in 2016, the figure of both parameters were elevated. Therefore, Her Royal Highness Princess Chulaborn Mahidol initiated the rabies elimination project in 2017 until today. Running the project resulted in declining of dead people and positive sample to the lowest number in Thailand, that is 2 people deaths this year. For area of rabies outbreak in Thailand, dead people and positive sample were found in southern part of Northeast, Eastern, and southern parts of Thailand. This is an obvious evidence that rabies is still a threat to human health and death in Thailand. Besides the impact on public health, rabies might fly a negative repercussion on the country economics, which strongly based on tourism industry. In addition, each year, the Thai government had to allocate a considerable budget for vaccination costs in both humans and animals. Rabies is carried by many mammalian species, especially dogs and cats, which are very close companions to humans. Naturally, integrated attempt based on One Health approach is deemed necessary to effectively deal with this zoonotic disease. To reach the goal of rabies elimination by 2030, WHO has set up strategic plan in three main principles for the control and prevention of rabies. Firstly, to establish immunity in animals, particularly in dogs and cats. At least 80% of dog and cat population should be vaccinated against rabies annually. State population must be at best managed under its current circumstances. Secondly, public education and participation at all levels in rabies campaign is it utmost important to properly educate the general public for better understanding of rabies in all aspects, including rules and regulations from national level to community level. Unlike other zoonotic diseases, rabies is often related to dogs and cats, very dear to many pet owners. Therefore, willingly communities' involvement is much required for success of many campaigns and initiatives. And thirdly, post-exposure prophylaxis management for general public based on good medical practice guidelines must be updated according to the correct scientific information and current condition. To achieve this goal, public health services must be well established and accessible. In Thailand, the public health services at community level are carried out by provincial and district health boards via government officials and community health volunteers. Moreover, rabies information management system must be well integrated by all responsible offices and parties to ensure competent, harmonized action plan. In light of this information, Her Royal Highness Princess Julapon Mahidol truly want to eliminate rabies from Thailand and the world eventually. Her Royal Highness therefore initiates the Saving Animals and Human Life from Rabies project, following the determination of Professor Dr. Her Royal Highness Princess Julapon Mahidol, which has been very well cooperated by Government of Thailand to declare as a country agenda. The project aims to eliminate rabies from Thailand by 2030 and has been started in 2017. This project has been carried out by relevant responsible offices and organizations to address rabies issue from national policy to community implementation through a strategic plan. Strategy 1, monitoring, prevention, and control of rabies in animals. Strategy 2, management of animal shelter. Strategy 3, monitoring, prevention, and control of rabies in humans. Strategy 4, rabies task force implementation at community levels. Strategy 5, rabies-focused public relations. Strategy 6, integration and management of rabies information. Strategy 7, following up and evaluation. And Strategy 8, innovation development and technology transfer. Strategy 1, monitoring, prevention, and control of rabies in animals. Responsible office at the national level is the Department of Livestock and Development, Ministry of Agriculture. However, some implementation tasks, such as dog population survey, rabies vaccination of household pets, are conducted by local administration offices, Department of Local Administration, Ministry of Interior. The main objective of Strategic 1 is to ensure the 80% of dogs and cat population have been vaccinated and 100% of dogs and cats within 5 kilometer radius of the reported rabies case will get rabies vaccination, and 100% of state population must receive sterilization. Therefore, veterinarians from all responsible offices conducted mass sterilization campaigns nationwide. Strategy 2, management of animal shelter. Besides pets with owners, Thailand have enormous number of dogs and cats living in public grounds. This stray animal can largely divided into two categories. Category 1 are dogs living closely with people in community, receiving regular feeding, but no owner, and some get rabies vaccination. Category 2 are dogs almost feral, living on the fringe of communities with no vaccination. Under Thai social and cultural context, is it not possible to conduct euthanasia of captured stray animals, even this animal may pose a severe threat as potential zoonotic disease reservoir? The initial step under the Saving Animal and Human Life from Rabies project to cope with the stray population is to establish 5 animal shelters in different regions of Thailand, together with setting up a standard guideline for animal shelters. This is to encourage the improvement of other animal shelters currently run by governments and non-government assessment, sterilization and vaccination therefore entering any shelter. Strategy 3, monitoring, prevention, and control of rabies in humans. The responsible office is the Department of Disease Control, Ministry of Public Health. The department conducted an active surveillance system under the district health board to ensure that post-exposure prophylaxis vaccination is accessible to all public with expectation of 0 human casualties. Strategy 4, rabies task force implementation at community levels. Since rabies had direct impact on animals, humans, and community, therefore local community play a fundamental role in the success of any implementation initiated. In Thailand, the Department of Local Administrations, Ministry of Interior, work closely with other relevant offices. For example, Municipality Office, Sub-District Administrative Office, Provincial Administrative Office, including Bangkok and Pattaya, issuing pertinent decrees, conducting animal population surveys and rabies vaccinations, organizing regular community meetings and communication. Strategy 5, rabies-focused public relations. The Department of Public Relations, the Prime Minister's Office, is responsible for raising awareness of general public regarding prevention in humans and animals. Strategy 6, integration and management of rabies information. A Center for Rabies Command is established to integrate rabies information collected from various responsible offices for effective analysis and dispatching appropriate action plan. Strategy 7, following up and evaluation. The Office of Permanent Secretary, the Prime Minister's Office, play a major role in following up and evaluation of implemented action plan for further improvement. And strategy 8, innovation development and technology transfer. Innovation development for rabies prevention and control according to the field situation, such as rabies diagnosis procedure, vaccine development of animal shelter standard guideline, and other educational institutions are in charge of this strategy. Implementation of this strategic plan has satisfactorily yielded preliminary results in phase 1. Number of dead people and percentage of positive sample in animals were reduced. However, to achieve the goal of 0 deaths, the project had then extended to phase 2, which focused on management of category of dogs and cats population, conducting rabies-free zone, enhancing of social engagement, and control of rabies outbreak along the borders. I hope that lessons learned from the Saving Animals and Human Life from Rabies project in Thailand with using One Health approach can be applied to certain situations in your working environments, so we could reach the common goal of the WHO to elimination rabies by the year 2030. Thank you very much for your attention.
Thank you, Dr. Tiang Tu, for the very useful information and also sharing on how Thailand controlling the rabies disease. Before we continue to the next speakers, I would like to inform to all participants, if you have question for Dr. Abila and also Dr. Tiang Tu, please add them to the question and answer box, and we will be able to answer some of them during the question and answer at the end. We will have a panelist discussion, so please you can write the question first in the chat box. Thank you. Now I would like to invite the next presenter, Dr. Tan Long Pham. Dr. Tan Long Pham is a veterinary epidemiologist working at Epidemiology Division of the Department of Animal Health, Ministry of Agriculture and Rural Development of Vietnam. His major focus is on terrestrial animal disease control and prevention, animal disease national surveillance program development, and disease-free compartmentalization support. Dr. Long Pham has more than 20 years of experience working in virology laboratory of the National Center for Veterinary Diagnostic and Epidemiology Division of the Department of Animal Health of Vietnam. Today, Dr. Long Pham will explain about rabies control in Vietnam. Please welcome Dr. Pham. Dr. Pham, the time is yours, please.
Thank you, Professor Mahan. So I would like to share my screen. Can you see?
Yes, please.
Okay, ladies and gentlemen, my pleasure is to present in brief our rabies controls in the countries of Vietnam. And as you know, rabies is a deadly but preventable disease. However, according to WHO, every year we record about 59,000 rabies cases in humans, and 99% are from dog biting, and 40% of the victims are children under 15 years old, and 95% of deaths are in Asia and Africa. I would say that's in developing countries. And out of 29 million PEP cases, so 90% is from Asia. And the disease caused the loss of economy is about 8.6 billion US dollar per year. And from this map of WHO, you can see that most of the parts in the world, in Asia, Africa, and South America, are in high risk of the disease. And except in North America and Australia, New Zealand are in low risk or no risk, but many parts in the world so are endemics of rabies. In Asia, during 2015 to 2020, we record that the disease increased more than 47% of human cases. However, China, the Philippines, and Vietnam still report the high percentage comparing to other regions about the human cases fatalities. For instance, in China, occupies 69%, in the Philippines 24%, and Vietnam 7%. And this diagram, we can imagine that so the different proportions of infected human cases in China, the Philippines, and in Vietnam in 2020, from 2015 to 2020. How about in Vietnam? During 2005 until 2015, every year we reported about 90 people died by the disease, with more than 400,000 PEP cases. During 2012 until 2016, the numbers of victims died by the disease reduced to 88 people per year, with less than 400,000 PEP cases. And for last 5 years, 2017 to 2021, we recorded significant reductions of human cases died by the disease until 74 cases. But we could see that so the higher numbers of people receive the post-exposure prophylaxis. From these tables, you can see that so for our dog and cat population in the countries during 2012 to 2016. So the population was more than 8 million animals, but nowadays the number of dog population reduced about 7 million. But for our vaccination coverage increased from 39, almost 39% up to 49%. So it's good. However, the areas of rabies circulation increased from 23 provinces in the last previous up to 41 provinces. So broader geographic distribution of the disease, and this is the number of dead people here for the periods of 5 years during 2012 to 2016, and for compared to the periods for last 5 years. And this number of people received the vaccines for treatment after biting by dogs. And from our calculation, if we can pay for the vaccines in Vietnam around 22,000 VND, or we can exchange into $1 US, compared to PEP's cost around 153 US dollar, we could see that so 150 times higher the cost if we vaccinate dogs. So we can see that so if we invest for dog vaccination, so we can save the money. In last year, there was 42 deaths in 22 provinces. We received these numbers from Ministry of Health, and for first 8 months in this year, so far we received 36 deaths in 15 provinces, and for PEP every year, so now around 500,000 cases. And our government approved our so-called national program to control rabies from 2022 until 2030, and we try to aim to get 0 human cases by rabies by 2030. Actually, for our specific objectives for animals, we try to improve our dog management and improve the vaccination coverage for dog populations and establishment of rabies-free zones. But for humans, we would like to establish PP treatment points at district levels. At the moment, in Vietnam, there are more than 700 districts. That means we aim to build 700 points for PP treatment. And also we will focus on risk communication and awareness about rabies at communal levels and at schools. And we establish our national reporting system for rabies, especially, and also PP improvement nationwide. And under this objective, we focus on 13 key control measures. The first one is the management of dogs and cat population. That means we would like to get registration of every dog and cats keeping at households to local authorities. Because without registration, we cannot identify exactly the population of animals. And later on for not only management, but also for vaccinations. And the second control measures, we focus on vaccination for dogs and cats. And the third one is the PEP for humans. The fourth one, we improve our regulation and policies for rabies prevention and controls in the countries. We need to review our current regulation, but when we identify any gaps, we need to change or maybe to work to develop the new guidelines, new policies for rabies controls of the countries. The fifth one is for information and communication to raise awareness, attitudes, and behaviors of the people in terms of rabies prevention and controls in the countries. The sixth control measures is to improve rabies outbreak investigation, response, and controls. The seventh measures is rabies surveillance in animals. The eighth one, the surveillance in humans. The ninth, we try to strengthen our laboratories testing capacity in both animal health and public health sectors. The 10th, as I mentioned in our objectives, we try to establish our rabies-free zones in the countries. And at the moment, I would say that Ho Chi Minh cities obtain our certified rabies-free zones at the city levels. And in Hanoi, also, some districts, they obtain our rabies-free zone. The 11th control measures is for dog and cat movement controls across the countries, and also we try to enhance movement controls across the borders. The 12th one is scientific research, collaboration in research, production, and supplies the vaccines. And the last one is the international collaboration. And the financial mechanisms we mobilize from different levels, at national levels with the central budgets and local levels from provinces budgets. And we mobilize also from other sources, including international support. And for rabies control and prevention, it actually is One Health approach, as Professor Quazas and Dr. Abilab mentioned before. So in Vietnam, we applied the method so-called integrated by case management. And these activities consist of collaborations from different sectors, from public health, animal health, private sectors, and even authorities. So this diagram, how we conduct the integrated case management. Okay, so that's for you to imagine this one. And when we receive any suspected case reported whenever from dog owners or from someone in the field, the team from CDC province or sub-department of animal health, we assess the situation and we decide which pathway we can follow for investigation, collect the samples, testing, etc. Okay. And the results for last 5 years, in 2017, we piloted in one province, and at that time we detected the positive rate around 28%. And for the first 8 months of this year, we are implementing in 7 provinces, and detected rates was 50%. And to sum for the last 5 years, so we conducted more than 5,000 investigations, and we collected more than 1,200 samples. Among that one, we found the positive was 14%. Another component of our rabies controls in Vietnam, that means we would like to have our good reporting system through VAHIS, this one Vietnam Animal Health Information Systems, for real-time reporting, and also to keep our data of rabies. And actually, the VAHIS system was constructed at the beginning in 2018, and for rabies component, it was upgraded in last year. And this one example, that's so for rabies information in animals, we reported to our system together with both animal health and human cases in the system. And the last topic I would like to share with you, that's every year we organize our event during our World Rabies Days. And in this year, the titles of our World Rabies Days is One Health, Zero Deaths. And we organize in Bến Tre province in the south of Vietnam, where they reported 12 human cases this year. And this event, every year we organize, and we invite several hundred people from different levels, from ministries of health, ministries of agriculture, all 63 provinces to come. And we invited also the international organization, for instance, FAO or WHO and USAID, for instance. And this year, Ministries of Agriculture is leading this event. And next year, Ministries of Health will lead the event. We do alternately between 2 ministries every year. So that's also I would like to share with you, and thank you for your attention.
Thank you, Dr. Long, for the addressing this interesting topic and share with us about the controlling rabies in Vietnam. Now, I would like to invite the next presenter, Dr. Sujan Rana. Dr. Sujan Rana is a Nepali national and worked as a senior veterinary officer at the One Health Section, Department of Livestock Services, Nepal. He has more than 15 years of experience in the government services, academia, and non-governmental organization. Dr. Rana obtained his veterinary degree from Nepal and is a Master of Public Health graduate from the Ohio State University, USA. Dr. Rana is also an executive member of Nepal Veterinary Council, the veterinary statutory body of Nepal. Today, he will talk about the rabies control in Nepal. Ladies and gentlemen, please welcome Dr. Rana. Dr. Rana, the time is yours, please.
Thank you for the nice introduction. I'll be talking about the status of rabies in animals and its control in Nepal. Here is the outline of my presentation. I'll be talking about Nepal at a glance, rabies in Nepal, the share assessment we carried out in Nepal, and the rabies control activities we have been carrying out, and the rabies control strategy that is in the draft stage. And then I'll be talking about some gaps and challenges we have in the country and the need of for our country to embark in the journey of rabies control. So while talking about Nepal, it's a landlocked country in South Asia. It borders India in the east, west, and south, and China in the north. So after the political change in 2015, Nepal is divided into 7 provinces, 77 districts, and 753 municipalities. The governance system of Nepal has changed from the unitary system to federal system. Nepal is divided into mountain, hills, and Tarai. While we're talking about the Tarai, those are the flatlands. While we say hills, they are the mountains without the snow, and while we say mountains, they are the real ones covered with snow. So rabies is endemic in Nepal, and it's actually maintained in 2 cycles, both cycles actually. It has this urban cycle and the sylvatic cycle. And more than 150 animal deaths are officially reported annually in Nepal, but we believe that this is quite an underreporting, and the real animal loss must be quite higher, much higher than the reported one. So while talking about the estimated so the reports, as we talked about earlier about the animal deaths, it's the same with the human deaths. Reported deaths are quite low as compared to the estimates, and some organizations have even estimated a much higher figure about the human deaths in Nepal. So while we talk about the species affected in the country by rabies, we can see dog, cattle, buffalo, goat, sheep, pig, equines, cat, yak, mongoose, and jackals infected by rabies as yet. But in Nepal also, dog transmitted rabies is the predominant source of human rabies. So we can see the outbreaks reported of animal rabies during the period of 2001-2019. So on an average, 100 outbreaks are reported in the country every year. So while talking about the stepwise approach to rabies elimination, it was an assessment was carried out in Nepal. It was a SARC program actually, and it was Nepal also participated in the event. And the score of Nepal in the SARE assessment was 0.5 out of 5, and the SARE assessment clearly showed us the pending activities that we need to accomplish in the days to come to achieve the target of 0 by 30. So while talking about the SARE assessment, we had also worked on the practical work plan towards approaching rabies elimination, and it had kind of showed us that we would need 13 more years to achieve the target of 0 by 30. So what Nepal is doing right now to control rabies, I will talk a little about that. So we maintain peripheral vaccine banks. We have peripheral veterinary laboratories which maintain the peripheral vaccine banks. So we have 5 peripheral veterinary laboratories. Apart from the maintenance of the peripheral vaccine banks, we carry out outbreak investigation and responses, and laboratory diagnosis is carried out in the central veterinary lab actually, and the peripheral labs don't do much in diagnosis, but they carry out the rapid tests only. And we have a national vaccine production laboratory in the country, which produces anti-rabies vaccines. It has been producing vaccines since 1970, actually, but it adopted the cell culture vaccine. It started producing the cell culture vaccines in 2007, and we carry out education and communication campaigns, programs, and there are school awareness programs conducted every year during the rabies day, not just the rabies day, but let's call it the rabies week or the rabies month kind of thing. And we carry out vaccination campaigns. Apart from that, we carry out capture, neuter, and vaccinate and release campaigns. And to aid all these things, we carry out capacity building programs of the human resources, and we have been also doing working towards the capacity development of the institutions under the Department of Livestock Services and other institutions in other tiers of the government. And the recent thing, kind of the achievement for us was rabies was not a notifiable disease in the animal health sector. Earlier in 2019, rabies has been listed as a notifiable disease in the animal health sector. A case definition of rabies has been in place, and we have been able to draft the rabies control strategy, but it has not been approved yet. So in all these control activities, the federal government, the provincial government, and the local governments kind of are doing their share, but maybe it is not as coordinated as it should be. And apart from that, there are non-governmental organizations working towards rabies control. I must here remember the name of the Federation of Animal Welfare Network in Nepal and the Nepal Veterinary Association, who have been working, supporting the government towards for control of rabies in the country. So as I told you earlier, there's this National Vaccine Production Laboratory under the Department of Livestock Services that produces anti-rabies vaccine. So you can see the production of the anti-rabies vaccine in the bar diagram. And last year, we produced 160,000 doses of rabies vaccine in the country. So while talking about the rabies control strategy in Nepal, rabies control strategy in Nepal was kind of drafted by the animal health sector earlier, but later there was this realization made that we need to draft a rabies control strategy in a One Health approach. So then people from different sectors came together, people from the public health sector, people from the animal health sector, and even the environment sector came together and drafted, and we have drafted this rabies control strategy recently, and it's still in a draft stage, kind of finalized, but has not been approved yet. And the vision of the rabies control strategy is achieving a rabies-free community, and the objective obviously is to eliminate dog-mediated human rabies by 2030. And this rabies control strategy actually is an amalgamation of 5 strategies. And while talking about the 5 strategies, we have been focusing on surveillance and laboratory diagnosis as the first strategy, which includes things about surveillance, joint investigations, and laboratory diagnosis kind of thing. As of now, the central veterinary lab is the only lab which can diagnose rabies in Nepal. So we are trying hard to develop this capacity, extend this capacity, expand this capacity in all the peripheral labs, and that's what this strategy talks about. The second strategy is the mass dog vaccination, and as we all know that it's the mainstay of any rabies control program anywhere. So it has been listed as another important strategy in the rabies control strategy in Nepal. Yet another strategy is the integrated bite case management. So as it all the relevant sectors, all the stakeholders have not been able to work together, work in a coordinated way in Nepal. So this strategy, the integrated bite case management, will help the human health sector, and the animal health sector to come together and work together and report each other of the outbreaks in their own sectors. So the fourth strategy under the rabies control, the draft rabies control strategy in Nepal is the dog population management. And while talking about the dog population management, we also talk about the dog registration, and the animal birth control kind of things. And to add to that, we also talk about the garbage control, which is quite important in the dog population management. And finally, in the fifth strategy under the draft rabies control strategy in Nepal, we talk about the capacity building and advocacy and communication. And while talking about the capacity building, we talk about the capacity building of not only the human resources, but also the institutions and organizations that are working towards rabies control in Nepal. And we realize that the most important thing for something to kind of happen is the political commitment. So advocacy and communication has also been a part of the rabies control strategy, and we have also kind of included different kinds of coordination committees and task forces under this strategy, so that we can carry out the monitoring and evaluation of the programs conducted, and also get the works done effectively in a more coordinated way. So as of now, we have been carrying out vaccinations, we have been carrying out awareness programs, we have been carrying out some caps and neuter vaccinate and release programs. But as I mentioned earlier, we have not been able to get this rabies control strategy approved and have not been able to move forward in a directed manner. So that's quite a gap and a challenge for Nepal right now. So we have realized it, and we have drafted a strategy in a One Health approach. A One Health strategy, this One Health strategy was approved in Nepal in 2019, and the rabies control strategy holds the spirit of the One Health strategy that was approved back in 2019. And rabies control cannot be done by a single sector. It's a shared responsibility, and a sustainable budget is required for it. So this is another gap and a challenge we are facing. And to add to that, challenges of dog population, we also face the challenges of dog population management. We face the challenge of dog estimates, dog registration. So the municipalities, some municipalities have been trying to kind of have this dog registration mandatory, but they are facing challenges. So this is another challenge for us right now. And animal birth control of the stray dogs, street dogs, is not that easy, and it has been another challenge for us. And for dog population management, garbage control is equally important, and we have been facing problems with the garbage control, and we have to bring together people working in the in that sector so that we can work together to control rabies. Apart from that, as I told you earlier, the laboratory capacity, while we are talking about laboratory capacity in Nepal, the central veterinary lab is the only lab that diagnoses rabies. So this is another challenge for us, another sector, another area for us to work on, so that we can expand our capacity, extend our capacity of rabies diagnosis at the labs at the peripheral levels. And as I showed you earlier, the terrain of Nepal is divided into 3 ecological zones. So this is another problem that we face at times, which poses as a challenge for us. The cold chain management of the vaccines in the difficult terrain is quite a challenge for us. So finally, the need of the hour for us is we have to advocate more. We have to achieve the political commitment so that we can approve the national rabies control strategy that we have drafted in our One Health approach. And having said that, an estimate of the dog population is quite needed. As of now, people talk about the population of other livestock, but the population of dog has not been estimated in the country as yet. So it has to be carried out very soon, and responsible dog ownership is yet another need of the hour for Nepal. And while we are talking about control of rabies, obviously the dog birth control programs, mass dog vaccination are very critical to the success of the program. And we cannot achieve all this unless we work hand in hand with other stakeholders, with other sectors in the country, and we must work in a One Health approach. And finally, the capacity development is quite an essential part for the control of the rabies. So finally, I've come to the acknowledgement part. I would like to acknowledge Dr. Barun Kumar Sharma, the DGPLS, Dr. Jitendraman Shrestha, is Senior Veterinary Officer, Ministry of Agriculture and Livestock Development, Dr. Mukul Upadhyay, Senior Veterinary Officer, Department of Livestock Services, Dr. Manishman Shrestha, Senior Veterinary Officer, National Vaccine Production Laboratory, Dr. Surendra Karti, National Technical Coordinator at Nepal, and Dr. Barsa Thapamagar, Veterinary Officer, Department of Livestock Services, for their inputs in preparing the slides. Thank you so much.
Thank you. Thank you, Dr. Rana, for the very informative presentation, and also sharing the experience in Nepal controlling the rabies disease. Now we are finished all presentation, and we are going to the discussion, question and answer. For participants who want to ask something, please write your question to the chat box. So we will collect it, and the panelists will answer your question. Is there any question? Is there any question or not yet? Okay, if not, then I would like to ask, please join all the presenter, Dr. Long, Dr. Rana, and Dr. Abila is not able to join on this session, on the discussion, but okay. First, I would like to ask to Dr. Long. Dr. Long, the rabies control in Vietnam, as also in most of Asian countries, is still a problem. We have a problem for controlling this disease. How the relationship between the domestic animal and wild animal in this spreading of disease, or in the eradicating or in the controlling of the disease in Vietnam? Dr. Long, please.
Thank you, Professor Tata. Some very tricky questions. When we talk about maybe the circulation of the virus between the domestic animals, carnivores, and wild animals. Actually, in Vietnam, so far we have not received any reports of previous case in wild animals yet. Maybe the disease is there, but we don't have reports, we don't have samples, and we do not test. So that's why we cannot answer that. So the disease is present in wild animals. However, we try difficulties to control rabies in domestic dogs mostly, and followed by cats because of we cannot vaccinate or for whole populations, or at least 70% and more. Because of, as I mentioned, that the disease is a preventable disease, but in reality, we need to have good correlation of dogs owners when we try to provide the vaccines to the dog population. Because of, I would share with you that in remote areas, mostly in remote areas, even though we can subsidize the vaccines to dog owners, but the owners, they don't want to vaccinate their animals because of maybe they don't think that the rabies is dangerous, or they don't want the strangers touch their animals. There are several situations that the owners don't collaborate with veterinary officers to vaccinate their dogs against rabies. That's the problem. So in our national program, we include communication and public awareness for the communities, to they be aware of the risks of rabies. And another fact that in our remote or rural areas, many victims, they believe that so for rabies they can use this traditional medical treatment. They don't come to the medical center for PEP. They treat by local medicine. So they a lot of limitation of their knowledge and awareness about the disease in Vietnam.
Okay. Okay, thank you, Dr. Long. And there is a question, but before I would like to ask first Dr. Sujan. Dr. Sujan.
Yes.
In your presentation, that estimated of the death is about 100 people. And I would like to know that which animal are most common that infected human, of course, like dog and other animals, and what the involvement of public figures, because we know that the successful of vaccination program or controlling the disease is also involving the public figures like religion leaders or villages leaders and other leaders, especially the local. Do you have any experience for this, Dr. Sujan, please?
Yeah, you are right about it actually. And as you mentioned earlier, dog bites are the predominant causes of human rabies in Nepal. And they say that they estimate that 95 to 96% of the rabies cases, human rabies cases, are due to dog bites. So while talking about the use of the celebrities or people known in a specific, in a particular sector, I also believe that it can come in quite handy and is quite effective while we're talking about communicating with the public. And we have also been thinking about it, and actually the public health sector can afford it and sometimes uses the celebrities and the popular figures for a communication kind of thing. But as of now, the animal health sector has not carried out such activities as yet, but we have it in mind, and we have discussing about it, and bringing forward a celebrity or a public figure to deliver a message for the public.
Okay, thank you, Dr. Sujan. So we have a question from the participants. You also can read in the chat box. First is in general, how effective is the rabies control strategies in Asian region? So for maybe for both of you, how effective this rabies control in your countries, in Vietnam and also in Nepal? Actually, this question is good for Dr. Abila, who looking widely in Asian, but unfortunately he cannot join in this discussion time. So Dr. Long and Dr. Nepal, you have any opinion for this? How effective these control strategies? Dr. Pam, Dr. Pam, Dr. Long.
Actually, so it's when we conclude that so good effectiveness, so we need to evaluate that one. But from our observations for different periods in my presentation, we could see that in Vietnam every year we increase the vaccination coverage for dog population and reductions of human cases. So that means we can see some improvement in rabies controls in the countries. But the disease is still there with more than 40 human cases per year and 500,000 PEP cases per year. So I cannot say it's good or not good. So it's difficult to conclude that so we can do efficiently in our control program. But anyway, we do hope that so when we follow 13 key control measures for our national programs from now until 2030, we can achieve the zero human case. But we accept that so maybe still can still some animal cases in 2030 still have in our national program.
Okay. Okay, thank you, Dr. Long. And Dr.
Yeah,
please.
while talking about control programs, as I mentioned earlier, there have not been coordinated efforts and an absolute control program for rabies in Nepal. We have worked in kind of in tidbits. As I mentioned earlier, we have been doing mass vaccination program. We produce vaccines on our own. The National Vaccine Production Laboratory under the Department of Livestock Services produces vaccines on its own, but it's not enough. While we see the dog population and the number of vaccines produced, we are quite not producing enough for that purpose. We import more than 300,000 doses of rabies vaccines every year, but still we run short of the amount we actually require for dog vaccination. So although we have carried out everything that has to be a part of the control program, but we have not done it in an absolute way that actually can bring out a good outcome kind of thing. So we have yet to see what a control program actually is and what a control program can kind of result into. But having said that, we have realized that when we vaccinate enough in an area, that human rabies cases are reported less. We have some instances, but we cannot be sure about how control programs actually what kind of outcome a control program actually has, because we have not we do not have a full-fledged control program yet in Nepal. Thank you.
Okay. How many % of the covering vaccination for the susceptible animals in Nepal?
Yeah, that's quite a question for us actually. As I mentioned earlier, we have not yet carried out a dog population estimate in the country. in the overall country. We have kind of carried out some estimates in smaller areas, but we do not have dog population estimate for the whole country. So we cannot be sure of our coverage of vaccinations, and I don't believe that the vaccination coverage is good enough.
Okay, thank you. And in Vietnam, Dr. Long, how many percent the coverage
At the
vaccination?
moment, yes. At the moment, we estimate that 40% of vaccination coverage for the population.
Okay, thank you. And now we have another question from the audience. How many types of virulent rabies virus in our Asian? So maybe from Nepal and also from Vietnam. Is there any types? How many types of the virus? Variant, I mean. Maybe this from Ye Aung. How many types of virulent rabies virus in our Asian country? Maybe from Vietnam and Nepal. Do you have a data or information about the type of virus?
Sorry, because I'm not a people working in laboratories, and I don't have information about this.
Okay.
But so far, I know that our vaccines available now in Vietnam can prevent the disease in animals if we apply the vaccinations to our dog population.
Okay.
Yeah,
Thank you.
even I'm not aware of that. Yeah.
Okay. So at least we have enough virulent virus in the street, in the field, yeah, and maybe we can have another information for this answer on the other event. And the other question is also from participants. Is there any oral rabies vaccine available in Vietnam or Nepal? All the vaccine is just by what you call it, injection. Is there any oral vaccine available in Nepal or also in Vietnam? Dr. Long and Dr. Rana? Dr. Long?
We don't use oral vaccines for the animals. Actually, once I remember 3-4 years ago, the OAE offers to use the oral vaccines, but we have to follow strictly guidelines of using oral vaccines. Every day we have to monitor, and in periods of time we have to take back the bed, etc. So quite complicated. So that's why we did not apply, receive and apply the oral vaccines for our animals.
Okay. So most of all are injection, yeah?
Yes.
Okay. So in Nepal, how about in Nepal?
As for Nepal, as yet, we do not have oral rabies vaccines in Nepal, but with the support of OIE, we are intending to pilot a program in the near future, but let's see what happens.
Okay. So I think if there is available for the oral, it's also good for example, for controlling in wild animals, yeah, except for because for wild animals it's also very difficult to keep one by one, and so it is hopefully in the next time we future we have available this oral, I mean available for all Asian countries, because mostly injected vaccine as we done currently. Okay, there is no question from participant, and still we have time for discussion. So just one question for both of you. Of course, you already mentioned also about the how to controlling the disease, but we want to take home message, take home message for what the main problem in controlling rabies in your country. So this is maybe for participant, all of us can also make preparation for how to solve this problem. Maybe the same problem or maybe a different problem. Dr. Long, please.
I think that's so. For rabies problems, that's we need to improve the awareness of the people, both by dog owners and also by the victims. They should be aware of the risks of rabies disease. We know that so if the people getting bitten by rabid dogs, so 100% will die without treatment if they don't get post-exposure prophylaxis. So if that's the major problem, then we, from my point of view, that's so we need to communicate, educate for the communities, for the societies about rabies. And then we can improve the vaccination for our dog population. That means we control rabies from the source, vice versa. So we provide PEP to the victims. So in this case, we target maybe 0 human case and later on 0 dog case, animal case, I would say. Over to you.
Okay, thank you, Dr. Long. So public awareness is very important, yeah, in Vietnam, because people will aware about how dangerous of this disease. And in Nepal, Dr. Sujan, Dr. Rana, Sujan Rana.
Yeah, what I feel like is political commitment has been quite a problem to us. I think we have not been able to approve the rabies control strategy as yet, which has caused us to carry out activities in an uncoordinated way, in a way which is posing a problem for us kind of to guide towards a fixed direction. And apart from that, awareness is quite a problem. And while we are talking about Nepal, Nepal has kind of a range of terrain, and people in the harsh terrain kind of they're quite hard to reach, difficult to reach. We do not have a kind of proper transportation measures kind of thing. So we have not been able to reach out to them in terms of proper awareness and communication kind of thing. And to add to that, while we are talking about the dog population management kind of thing in Nepal, garbage management has been posing quite a problem. The municipalities are facing problems in disposing of the garbage, and which have kind of served as a means for the dogs to survive and kind of get their food from. So this kind of things have been posing quite huge problems for us for rabies control in Nepal.
Okay, thank you, Dr. Rana, for yes. I think the same points are also arise in every country about this. Yeah, but I can, before we finish this session, because the times also goes quickly. So before we closing, so I would like to summarize that or make the very short conclusion of this, that since we are in Asian countries also suffer from this disease, and also in every country they have their own problems. So what we have to do is work together. We have to work together for this controlling the disease, and hand in hand in all sectors, in animal sectors, in human sector, and economic sector, and every sectors we have to hand in hand to control this disease. So, thank you very much for all speakers for their nice, clear, and very important information and share on how to control the rabies disease. And hopefully what we are received today will be very useful and beneficial for us in order to combat the rabies in our country. To make the region achieve as a free rabies disease with supporting for the goal of world-free rabies. Before I close this session, I would like to invite Dr. Isao Kurauchi, the FAVA Vice President and the President-elect, to give a closing message of this today's webinar. After that, we also have some information for all of you for our next event. Dr. Kurauchi, please, the time is yours.
Thank you for joining us today for Rabies One Health Zero Death. I appreciate Dr. Evra from WAH, Dr. Tiasan from Kasetsat University, Dr. Ming and Dr. Rana from Vietnam and Nepal, respectively, for their wonderful talk. I would also like to thank Dr. Kwaza, Dr. Bamba, Dr. Acharya, and VNU Asian Pacific for organizing today's seminar. In Japan, the rabies outbreak was eliminated in 1956. Asian Pacific for organizing today's seminar. In Japan, the rabies outbreak was eliminated in 1956 due to the effort of our predecessors. Even today, we continue effort to prevent rabies, including mandatory rabies, vaccination of dog, and quarantine of imported animals to keep rabies-free status. I hope today's seminar will help eliminate dog-mediated rabies deaths in the Asia-Oceania region. This November, FAVA Congress will be held in Japan for the first time since 2018. I hope you will take this opportunity to attend the event in person, strengthen the Asia Veterinary Professional Network, and join the discussion on One Health. Thank you for your kind attention.
Thank you, Dr. Kurauchi, for the closing message. And before I close this, I would like to inform to all of you, the participants, about the FAVA Congress that also Dr. Kurauchi already mentioned. For next November, we will hold the FAVA Congress, and also we also invite you to the pet fair in October next month. Please, can we watch the promotion?
人と動物の命は一つなんだと、それは地球の願いであると、これを僕は活動方針に決めました。
日本獣医師会は2022年11月第21回アジア獣医師会連合大会を開催します。アジアからのワンヘルスアプローチがテーマ。開催地は日本のワンヘルス先進都市福岡。福岡からアジアへ向けて、世界へ向けて発信します。2022年11月11日から13日までの3日間、会場は海に開かれたホテルヒルトン福岡シーホーク。
私たち人類は人と動物の共通感染症、薬剤耐性、環境問題といった難題に直面しています。この地球で私たちが存続していくために、今世界がワンヘルスを求めています。福岡は古くからアジアの一大交流拠点として栄える一方で、天然痘など恐ろしい感染症の問題が身近にありました。我が国のワンヘルスを牽引するここ福岡でFAVA大会を開催できることを嬉しく思います。
アジア獣医師会連合はアジア・オセアニア地域23カ国地域の獣医師会の連合組織です。各地域の獣医師の連携を図り、獣医学教育や獣医学研究の改善に協力して獣医業の地位を向上させることを目的に1978年に発足し、さまざまな活動に取り組んでいます。大会当日は3000名の参加者をお迎えします。ホテルに宿泊いただき、獣医学の最先端を学ぶ3日間です。またエクスカーションツアーやオプションツアーもご用意しています。近年地球上はさまざまな災害に見舞われています。その中でも新型コロナウイルス感染症の拡大に代表される生物災害が大きな脅威となっています。そこで生まれたのがワンヘルスという地球規模で取り組む活動なのです。人の健康と動物の健康と環境保全を一つとして捉えて、医師や獣医師、環境の専門家や研究者だけでなく、みんなで考えて行動しようという社会活動です。1993年のベルリン宣言を皮切りにワンヘルスの重要性が認められ、世界的にもさまざまな取り組みが行われるようになってきました。日本獣医師会では2010年に動物と人の健康は一つ、そしてそれは地球の願いを獣医師会活動方針としました。2016年福岡で開催された第2回ワンヘルス国際会議において、ワンヘルスの考えで行動し実践する福岡宣言が採択され、2020年には福岡県ワンヘルス推進基本条例が全国で初めて制定されました。福岡ではワンヘルス先進県としてワンヘルスフェスティバルや国際フォーラムなどを開催。また次世代を担う子どもたちへ向けリーフレットを作り、県内の学校へ協力を呼びかけ配布も行っています。ワンヘルスの重要性と取り組みについて日本政府トップへの直接提言を行い、その必要性について理解をいただきました。
政府としてはこれまでもワンヘルスアプローチに基づき 薬剤耐性 AMR 対策や鳥インフルエンザへの対応に取り組んできたところです。福岡県においては、ワンヘルスの理念を実践するため、全国に先駆けて条例を制定し、実践に取り組まれていると承知をしています。政府としても福岡県の取り組みも参考にしつつ、今後ともワンヘルスアプローチに基づく感染症対策に取り組んでまいります。
本大会では3日間にわたりアジアからのワンヘルスアプローチをテーマに特別シンポジウム、福岡県ワンヘルス国際フォーラム、アジアワンヘルス福岡宣言2022の合意につながるワンヘルスストリームが企画されています。
動物、植物、自然に畏敬の念を払う日本の国民性はまさにワンヘルスを体現するものです。この地からアジアへ、そして世界へとワンヘルス活動を力強く推し進めていきたいと思います。世界が手を取り合い、素晴らしい地球を守りましょう。皆様のご参加をお待ちしています。
福岡はアジアの玄関口として歴史を重ねてきた都市。日本有数の大都市でありながら伝統や文化が息づいています。福岡からアジアへ、福岡から世界へ。この秋、皆様のお越しを心よりお待ちしております。